Hello, everyone, and welcome to the World Obesity Policy Laboratory. I'm really excited to be here today and to talk about physical inactivity and obesity and how can we break this cycle. And I have an amazing pool of panelists, and I think we're going to have a very lively discussion. So just before we start, let me give you some housekeeping rules. So first of all, the webinar will be recorded. So if there's anything that you hear and that you really want to know more, don't worry, you can always go back and listen to it. I hope, and I'm sure you're going to have plenty of questions during our webinar. You can use the Q&A function to post all the questions that you have, and I'm going to try my best to ask those questions to our panelists during the later part of our webinar. And finally, you're also going to have access to the slides. So again, don't worry if you missed something, if you didn't understand something, you will have the possibility of going back and hearing the recording and also seeing the slides. So this is me. My name is Olivia Barata Cavalcanti. I work at the World Obesity Federation as the Director of Science and Programs. I do have UK there because I'm based here in London, although it's not necessarily representative of where I'm from. I'm originally from Brazil, where I lived for a good part of my life before moving to Italy and then to New York with a brief stay in Mozambique, and now I'm here in the UK. So a little bit from all over the world. And my focus has been in non-communicable diseases. And for the last 10 years, I've been working and researching obesity. So this really is my passion. And today we're here to really try to put together the concept of physical activity and obesity. And we really want to try to, first of all, improve our understanding of the role of physical activity and exercise in obesity, both prevention and treatment. We want to reframe the obesity narrative, and we're going to spend some time talking about that. So it's not about individual responsibility when we're talking about obesity. We want to present global and country-specific recommendations. We're going to have some case studies, really interesting. And we want to showcase physical activity policy monitoring tools and all the different strategies that we have to foster environments that promote this active, healthy living. And finally, we want to actively discuss recommendations and practical actions that can turn physical activity guidelines and different recommendations into practice that we can all adopt. So first of all, today, it's an important day for us because we are launching our policy dossier on physical activity. And for those of you who are familiar with our policy dossiers, you know that those are very deep and well-articulated documents, and you're going to find all kind of evidence and resource and materials that relate to obesity and physical activity. And we're also going to explore the recommendations at the global level and some country-specific case studies on different policies and interventions that have been or there maybe should be implemented to increase physical activity. And so this is just a little reminder of what we're going to talk about today. First of all, we're going to hear from Margot Neveu. We're going to talk about the role of physical activity and exercise in obesity and the position statement from the organization, from our organization. We're going to go over to Dr. Fiona Bull and talk about global recommendations on the topic. We're also going to explore the moving policy database with Kate Aldridge Turner. And then we're going to go over to our case studies, first from Poland, from Professor Alexandra Luzenska, then from Professor Shipalika Goenka with a spotlight in India, and then from Professor Greg White from the UK. And then I really hope we can have some time for a Q&A with all the panelists, where you're going to have the opportunity to ask all the questions that you have, and we're going to say our goodbyes and with some closing remarks. So this is for you to have an idea of this amazing group of panelists that you have today. I'm going to introduce you all of the speakers now, but as you can see, we really try to have a global representation. And I think without further ado, we can move and start with the role of physical activity and exercise in obesity. which our senior policy manager, Margot Nouveau, is going to present. Is going to present our statement. And Margot has a bachelor degree in global health and international comparative studies from Duke University, and she also has a master of public health. And she's been with us at World Obesity since 2018, working in policy, and she's now our senior policy manager and involved in all of our advocacy and European Union projects, specifically Stop and Co-Create. So Margot, over to you.
Thank you very much for the introduction, Olivia. And I'm very happy to be here today to present our position statement. So if we could go to the next slide, please. So as you all know, Tuesday, April 6th, marked World Physical Activity Day. And so for the occasion, World Obesity decided to release its first position statement on physical activity and exercise in obesity. So we know that physical activity incontestably confers significant health benefits for everyone, independently of the intensity at which it is practiced, and it really should be promoted in the response to treat and prevent non-communicable diseases. And the impact of physical activity alone on weight loss is modest, but its impact on general health really should warrant for it to be considered a core component of obesity interventions, as well as included to ensure the sustainability of weight management programs. The WHO refers to physical activity as all movement, and popular ways to stay active include cycling, walking, sports, active recreation, and play, and it can be done by anyone at any level of skills at any moment. However, today, current levels shows that 1 in 4 adults, or 81% of adolescents globally, do not do enough physical activity. In fact, levels of inactivity tend to increase as countries develop economically and can be as high as 70%. And this is often due to a change in transportation patterns, an increase in the levels of sedentary behaviors, and also an increased use of technology during work and recreation time. Next slide, please. So one thing that we know is that eat less, move more alone when trying to address obesity does not work. Obesity is a chronic relapsing disease caused by the interaction of environmental factors and genetic predispositions. In addition, obesity also increases the risk for a number of other chronic diseases and can have harmful psychological, emotional, and social outcomes. However, people with obesity are constantly shamed and blamed for their disease because many do not understand that obesity is a chronic disease and see it as a simple lack of willpower, laziness, or a refusal to eat less and move more. But what we have found at World Obesity is that the root causes of obesity actually run deeper and can be genetic, psychological, social, cultural, economic, and environmental. Next slide, please. And so when looking at the evidence, we found that when an individual experiences rapid weight loss, there's a phenomenon known as metabolic adaptation that occurs, which is a slowdown of the metabolic rate, and it decreases the amount of energy we spend. We also found that individuals using exercise as a weight loss mechanism tend to overestimate the amount of energy they spend and consequently increase their caloric intake. And finally, evidence also suggests that physical activity can be beneficial for weight maintenance, and the levels of physical activities required for that to happen are going to be dependent from person to person, but also on the type of activities one engage in. Next slide, please. So physical activity incontestably confers a significant amount of health benefits. And despite being associated only with modest weight loss, it is important to remember that treating obesity is about improving overall health and not just about losing weight. It is possible for a person with a higher body mass index to be managing their disease and living at a healthy weight. Exercise and physical activity also leads to a reduction in blood pressure, type 2 diabetes, stroke, certain types of cancers, and heart attacks. It can also help to improve cognition in healthy people and also reduces the risk of developing cognitive impairments such as Alzheimer's disease and dementia. And it is also extremely beneficial for mental health through the secretion of key hormones. So all the benefits associated with physical activity really should compel us to develop policies focused on supporting and enabling everyone to engage in physical activity in our daily lives. And at World Obesity, we are really committed to reframing the obesity narrative away from individual responsibility and ultimately ineffective magic bullet solutions to address the global obesity epidemic. Instead, we really call for the inclusion of all factors related to the prevention, the management, and the treatment of obesity. And this includes dispelling existing misconceptions and promoting a better understanding of the role of physical activity and exercise in managing the disease. And if we can just go to the next slide, please. And so here we have a number of resources available, including the link to our recently released position statement and our policy dossier on physical activity and obesity. Thank you very much.
Thank you so much, Margot. I hope you all understood and really go to our website and make sure that you read our position statement and our policy dossier. And if you have any questions, again, feel free to use the Q&A chat. So I'm going to move quickly because I really want to give us some time for later as well. And it is my great pleasure to introduce to you Dr. Fiona Bull. She's the head of the Physical Activity Unit at the Department of Health Promotion, Division of Healthier Populations at the World Health Organization. She leads a team which provides global leadership on physical activity and supports country implementation of recommended policy actions as outlined in the Global Action Plan on Physical Activity 2018-2030. And if you can move to the next slide, please. Dr. Fiona Bull will talk to us about the guidelines on the global guidelines on physical activity and sedentary behavior. Welcome, Dr. Bull.
Thank you. Thank you very much indeed. And very good afternoon to everyone joining this day, celebrating working together on tackling obesity. So I've been invited to present the work WHO has completed on developing and updating the WHO guidelines on physical activity and sedentary behavior. We were asked to do this to update the previous 2010 guidelines. So it's been 10 years. They were warmly welcomed and they were launched in November last year. And I planned in the next sort of 5 to 8 minutes is to go through those guidelines, not so much how we develop them, but in fact what they are. So next slide, please. And I'm going to start with the main take-homes. What do they show? Some of that, of course, has just been covered by Margot in the position statement, of course. But the graph here simply shows that increasing levels of physical activity, that means the amount, not intensity, the amount of physical activity is associated with increasing benefits. So the more you do, the better. But most importantly, when you look at that green curve, you see that doing any amount of physical activity immediately provides benefits. There is a recommended range, and for adults, as displayed on this graph, it's 150 minutes to 300 minutes of a moderate intensity. So a brisk walking is one example. And benefits, the multiple benefits I'll go into, are afforded by activity of this volume. You can see on the right of that, though, benefits do continue. And I point out that the risks are very low, certainly at that low level of activity and into the recommended range. The second thing you can see from this in terms of the any move counts is that it's for all people. And I'll go on to explain that these guidelines were developed for all ages, from youth up to older adults, and for those people living with chronic disease, disability, and for women in pregnancy and postpartum. You'll see in the first message here, good for hearts, bodies and minds, is because the benefits I'm going to introduce are many, and they really are across all systems of the body, our mental health, and of course our hearts, where some of the strongest evidence, of course, is. Now, the last point to draw your attention to on this slide is indeed the fourth point, and it's the new recommendation from WHO. Because over the last 10 years, since 2010, there's been an increasing knowledge base and study, research evidence showing us that levels of sedentary behavior can have unfavorable impact on health outcomes. And we were asked to look at that evidence and see what it says to have a global position. And what it says is that too much can be unhealthy, but we cannot at this stage define exactly the amount. This is an unfolding area of research. Lots of measurement challenges and measurement progress going on, but you'll see in my last slide the relationship in more detail. So next slide, please. So those benefits that come from doing any amount and increase as you increase the level of physical activity, and as already introduced, WHO and these guidelines recognize physical activity can be in multiple ways. Simply walking, cycling, to or from work or school, or for pleasure, playing sport, recreation. And for children, we often call it play, but being active. And so we call that physical activity in terms of all movement. And here, and I'll let you read these out, you'll read them yourselves. You see the long list covering the mental, physical and muscular benefits that are afforded to all people of all ages from being active. Specific to children, there's new evidence that was incorporated into the guidelines on educational and learning outcomes, and the strengthened evidence around mental health, which is particularly important in terms of the last year and this year, the COVID. So an opportunity for us to really advocate for physical activity through the importance for physical and mental health. Now, why is this important for today in this presentation? Well, of course, looking at the guidelines in the area of overweight and obesity. This is captured under measures of adiposity, and there is evidence that there is a favourable relationship with more activity and favourable adiposity. But as is indicated in the position statement, there is modest evidence about physical activity being associated with weight loss. This is a real area where more research is needed. There's more research needed in all populations of higher quality, longitudinal studies. Much of the evidence is still cross-sectional, and that is limiting our ability to answer the important questions we want to. Now, if you want to know the specifics, we'll go to the next slide, because these infographics and materials are available. So very quickly, you see that we've captured the main headlines of how much, of what type, for the different age groups. So starting on the left, you see some icons there for young people, and that's the aerobic activity of 60 minutes on average a day across a week, and including the very important value of doing muscle strengthening activities. In the middle, you see the metrics for the adult population, that's adults and older adults. And of course, you see that mix of aerobic and indeed to the right in blue, the muscle strengthening done in different ways at the home. It's not meaning necessarily weight training in a gym. It can be for some, but everyone should incorporate this twice a week for adults, and for older adults with a specific emphasis on preventing falls, which is very important, maintaining balance, independent living, this multi-component physical activity. The last slide, this next slide, please, will just show the evidence and the guidelines for some key populations I introduced. And I can summarize this because the evidence is in fact very consistent, and the guideline committee group really converged that we should have the simplicity and coherence of common messages. And so the guidelines for people living with disability and chronic disease are the same as those already mentioned. However, let me emphasize that this does include prevention of disease progression. So for those patients with people living with hypertension or living with diabetes, it's important for preventing other conditions, but also for the prevention of the disease progression. And my next slide, please, will show that relationship I introduced about the benefits of physical activity and the detriments of too much sedentary time. This is called a heat map in the middle, and you can see with very low levels of physical activity on the x-axis and high levels of sedentary, you see the top red area. But we all want to try and have a mix. More activity and reduce sedentary time. And that's the take home from this slide. My last slide, please, is where does all this fit with the work of WHO and the work of promoting physical activity? Well, the guidelines were called because in 2018, WHO launched the new Global Action Plan on Physical Activity. So to underpin the need for advocacy, policy action, investment, and partnerships to promote Opportunities for Physical Activity. The guidelines are an underpinning document. They're available in the 6 UN languages, and many countries are already translating. And I hope I can encourage some of the audience to take on this and work with your governments or civil society to translate, and contact WHO if you're interested. To put these guidelines and the global action plan shown in the left into practice, we need to move and implement the known effective interventions. And that's what the guidelines are full of. They actually show how physical activity can be improved, increased in a number of ways. This slide is showing you a variety of places you can get lots more information. Scientific journals at the top on the right. Listen to more if you want the long version of this, or the very interesting webinar we had for the launch with practice examples. And we've got a lovely video, which I don't have time to show you yet today, but it's available for use. And I apologize, I think I have one more slide, please, Olivia. That's right, thank you. So this is the slide which just draws attention to where the global action plan was shown on the left, set the targets aligned to 2030 and the SDGs to improve health, prevent disease, but a whole host of other contributions that the policy actions of physical activity can offer. And on the right, you're seeing the rubric, the 4 areas of policy action. And as is illustrated in the introduction, it's not solely an individual issue. So we need a systems approach that will provide the environment, shown in green, the appropriate supporting mechanisms of surveillance, advocacy, research, and partnerships, shown in blue, and of course, the opportunities to be active, whether that's in structured, unstructured, to cycle or to walk. And the red and the last area is, of course, much more communication about these wide-ranging benefits of physical activity. I think you're going to hear a lot more about the Global Action Plan and throughout this seminar. And all of these materials are available at the WHO website. And Dr. Tedros shown there, it was at the launch of the Global Action Plan, and on International Day for Sport, Development and Peace, as well as World Physical Activity Day and the launch of the position statement on physical activity, Dr. Tedros addressed a webinar reinforcing the importance of physical activity, promotion, action, and partnerships through COVID and COVID recovery. So thank you very much for the opportunity to do this brief introduction. Thank you very much.
Thank you so much, Dr. Bull. And I can see on the chat that we received already quite a few questions. So I hope I'll have the time to ask them during our our panel at the end. And I do encourage everyone to go and see these resources, and the video is lovely indeed. So you should definitely check that out. Moving forward, it is now my pleasure to introduce Kate Aldridge Turner. She's the head of policy and public affairs at the World Cancer Research Fund International, and she leads the organization's policy work in areas related to diet, weight, and physical activity in cancer and NCD prevention. Kate has a background in human rights law, social policy, and has worked in a range of sectors, both here in the UK and in other countries. So today, Kate Aldridge Turner will be talking to you about the Moving Policy Database.
Thank you very much. And thank you very much for the kind invitation to come and have the opportunity to share some of the work that we've been doing and the tools that we've developed that hopefully you can all go away, look at, and use in your own work. Next slide, please. So I'm going to talk to you about the Moving framework and database, which has been developed under the mantle of a European Union project called Co-Create, which is confronting obesity, co-creating policy with youth. And the study aims to prevent overweight and obesity in adolescents by providing knowledge and infrastructure on policies to support making the healthiest choices their preferred one. And WCRF International are one of 14 organizations working in this very large project with lots of different roles. And we're responsible for looking at what policies are out there related to nutrition, diet, and also physical activity. And as part of this project, which is funded under the EU Horizon 2020 project, we have been looking at physical activity. So we are approaching at the end of our third year of the project, and it's my real pleasure to share where we've got to as part of the project and the moving tools. Next slide, please. So moving was developed as part of Co-Create, as I mentioned, back in 2018. And you'll see the graphic on the right. It is a policy framework. And this looks to identify the areas where governments should take action to promote physical activity. So as part of our work in the Co-Create project, we did an analysis of global physical activity policy literature dating back to 2004, including the WHO Global Action Plan on Physical Activity, or the GAPA, to see what policy actions are recommended to promote physical activity. And so based on this analysis, we identified a number of core themes, and we developed this graphic with letters to categorize the different areas where governments should really take action. And we did this in several rounds of consultation with physical activity policy experts who provided their expert guidance on this process of refinement. So to go into a little bit more detail on the next slide of what we've actually put together. So moving is structured around 4 domains and 6 policy areas. So at the top, you will see 3 of the policy domains, and we have worked very consciously to be in alignment with the WHO Global Action Plan on Physical Activity. And so you'll see they have very similar names. So active societies, active environments, and active people. And then we have also got 6 policy areas. So each letter of moving stands for a different policy area. So M is make opportunities and initiatives that promote physical activity in schools, the community, and sport and recreation. O is offer physical activity opportunities in the workplace and training in physical activity promotion across multiple professions. V, visualize and erect structures and surroundings that promote physical activity. I, implement transport infrastructure and opportunities that support active societies. N, normalize and increase physical activity through public communication that motivates and builds behavior change skills. And G, give physical activity training, assessment, and counseling, in healthcare settings. So as you'll see, each letter of the word moving stands for a different policy area. And then on the right, you will see a cross-cutting policy domain called active systems. So this is looking at specific characteristics within policy that really help drive the promotion of physical activity. And this includes things like governance, leadership, physical activity surveillance, interdisciplinary research and teaching, financing, monitoring and evaluation, and taking a life course health in all policies approach. So we have this comprehensive area which basically outlines the areas that government should take action to promote physical activity. So moving is now also underpinned by a new database of physical activity policies. So to move on to the next slide, please. So on the left, you'll see a graphic of the new database. And this was launched last June. And we have been working extensively to add policies to the database. Now, the database sits alongside our existing Nourishing database, which contains policy actions relating to diet and nutrition. And so Moving is its sibling. And this gives us the unique ability to search for diet and physical activity policies in a range of countries. We completely rebuilt the databases, and to date, we have 259 policy actions relating to physical activity. We also add policy evaluations where we find them. So far, we have 1, but we have covered 11 countries in detail relating to physical activity, and we will continue to add more. We've done a lot of work to make the databases as user-friendly so it can support your research opportunities. So you can share results on social media such as Twitter, Facebook, and on email. We've put all the data in a format that you can download and you can interrogate yourself in a CSV file. So you can filter that all and play with that as you see fit. We've written up a glossary of definitions and commonly used terms and provided advice on how to search the database. And what we are doing all the time is adding new policies or policies that we've identified on a continual basis, so it's always updated. I've put the link there, but there is also a really handy film which shows you how to navigate the databases and perform your own search. So this gives you the opportunity to go have a look and see what's in your country or what isn't, or if you know of policies that are missing, let us know and we'll put them on there. Next slide, please. So just to give you a snapshot of what we found in those 11 countries, we found policies relating to the school environment, the community and sport and recreation, training for professionals related to the workplace, the built environment, physical activity guidelines, communication campaigns, amongst many. So there's a real wide range, and we found policies in all those areas. Next slide, please. So how do we choose what to put in there? So because we are funded by a European Union grant, right now we do have a focus on 27 countries within Europe where we are conducting a systematic search. So there will be full data sets for 27 European countries in the first instance, but we are also adding policies where we find them from around the world. Again, if you are aware of policies that you think would be eligible, please let us know. We do have a criteria of what can be included. Policy actions need to be supported by the government. They need to be in effect, so currently under implementation, and they must relate to one of the policy areas relating to the moving framework, or in the case of our other database, the nourishing framework. And then they must be relevant to, in the case of the moving policy framework, must be relevant to promoting levels of physical activity. And then we have a quality assurance step as well. So when we identify policies, we reach out to in-country experts to get them verified and make sure all the information is accurate and up to date. Next slide, please. So we will continue to update our databases, but I just wanted to alert you to a couple of other things that we're working on as part of the Co-Create project, which I think would be of interest to everyone. We are developing a new policy benchmarking tool for physical activity, again, aligned along the structure of the moving framework. And that the idea is then that we can create a policy index for physical activity based on different countries. We are it is a work in progress, so I don't have something to show you immediately. I put up a prototype image there of what it could look like in the future, but it's just to say that these are the things that we're working on and we'll be excited to share with you in the future. Next slide. And that's all from me, so thank you very much.
Thank you so much, Kate. I know that our whole team, our data team at World Obesity, they're a fan of the database and they use it very often. So thank you so much for sharing that with us. I would like now to move to the case study section of our webinar. And we're going to first start with a case study from Poland, from Professor Alexandra Luzenska. Professor Luzenska is a professor of health psychology at the SWPS University in Poland, and she's a professional fellow at the Melbourne Centre for Behaviour Change in Australia. Her research focused on development, implementation, and evaluation of health behavior change interventions, and that includes physical activity promotion and programs. So welcome, Professor Luzenska, and we're excited to hear about your case study in Poland.
Thank you very much, Olivia. Next slide, please. I will very much appreciate the opportunity of sharing with you some examples of the policy ideas developed by youth in Poland. These policy ideas were developed using complex system approach within the Co-Create project that Kate was just mentioning a moment ago. Next slide, please. So, as many countries, Poland is an example of a country which has some policies, physical activity policies operating, but some are missing. For example, we do not have national guidelines for physical activity for any age groups, and we don't, the Polish government and Polish regulators do not acknowledge, for example, the WHO guidelines as well. And unfortunately, the levels of physical activity in Poland, as you can see, before the COVID pandemic were already pretty low. And they were approximately 16% of young people meeting the MVPA guidelines for their age group. And from our experience, these are the data that were collected using self-reports. So if you use the objective reports, for example, accelerometry-based measures, then you usually will come up with much less percentage of people, young people adhering to respective recommendations. So I will present the examples of two proposals of the policies developed by young people together with the local stakeholders, including, for example, the representatives of the local governments, in two areas. One area where youth was working on the policy proposal was the low socioeconomic status rural area, and the other is urban, relatively affluent area, which represents a large municipality. Next, please. Okay, so first we start with the rural, low socioeconomic area and the group of youth that was working there using a system-based approach to develop their ideas of policies promoting physical activity. The first policy was aiming at increasing accessibility through lowering prices for the facilities where youth could practice their physical activity. So the idea was, in general, the municipality will fund some discounts for young people to use these gyms and sports centers. So how can you gain this discount? There was a compatible idea which suggested that, for example, minutes or hours of volunteering in various community programs, for example, the programs that aimed at reduction of social inequalities in the community, could be used to earn the discounts by young people. And there was another compatible policy which was aiming at monitoring physical activity within the community and gaining further discounts. So young people proposed that the community would use and promote an app which would allow people to collect the points for their physical activity, and this points could be then further exchanged for some discounts, for example, in further facilities for physical activity, but also for purchases of healthy foods. Next. Okay, and here are the policy proposals from the relatively high socioeconomic status, large urban location, and young people working there were proposing the idea of a policy which was matching the existing policies in the municipality that was targeting health promotion and education. And young people have actually noticed that there is a lot of education regarding the various social issue within the policies proposed by the municipality, and a lot of discussion on chronic diseases. However, the awareness and of physical activity and its relevance is limited in terms of the policy. So they propose that actually combining the existing events, which were called Wrocław, this is the name of the city, for weekend, where there were educational meetings for people with, for example, chronic diseases or women who are pregnant, etc. There will be also accompanying events which would provide education on physical activity and information about the possible facilities which are available for the certain groups, as well as consultations with the specialists who could provide the evidence-based guidelines. That's it from me. Thank you.
Thank you so much, Professor Luzenska. I think it's always so inspiring to hear from the youth what kind of policies and what kind of responses they want to have for the problems that they're facing. So thank you so much for sharing that. And I want to move on to the next case study, which will focus in India and will be presented by Professor Shefalika Goenka. Professor Shefalika is a professor at the Indian Institute of Public Health and the Public Health Foundation of India. She's the head of social behavior sciences and bioethics. And she's the lead of physical activity and obesity prevention at the CDC. And she's an expert in not only physical activity, but cardiometabolic diseases. And thank you so much, Professor Goenka, for being here with us today and for sharing your case study.
Thank you very much. Next slide, please. So India is the second most populous country, the largest democracy, and houses 1/6 of the world's population. 70% of India is in the villages. We also have wide socioeconomic differentials, where about 1/5 of the population lives below the poverty line, and 90% of the rural households manage to have to subsist on less than $200 per month. On the other hand, India has more billionaires than United Kingdom and Canada put together. We thrive in our cultural diversity with every major religion living here. We have a secular fabric and more than 122 major languages. Next slide, please. Who would have thought that in a country where 1/3 of our children are either malnourished or anemic or stunted, and a large section live below the poverty line, obesity would be a problem? Well, obesity has doubled in the last 10 years in India. In every state of India, both in men and women, both in rural and urban people. Also, in addition, even in people who have a normal BMI, there's high and widespread central obesity, including in the non-elite segment. Also, for every 100 overweight adult, or every 100 overweight adults in India, we have 38 people with diabetes. This compares with the global average of 19 people with diabetes for every 100 overweight persons. We have the second highest number of diabetes people in the world, and obesity contributes to the maximum portion of the DALYs caused due to diabetes. Next slide, please. I think there's one slide which is missing. Well, I want to say that there are two slides which are missing. So probably they're the next slide. This is the last slide. So no, there's one before that. Okay, so we have a potent, there's one more slide which is missing. We have a potent solution available in physical activity, which forms an important lever which can lower the prevalence of both obesity and diabetes. As we know that the scientific benefits of physical activity continue to rise to almost 700 minutes per week, which Professor Bull has already shown. What I'd like to say, there's certain barriers where physical activity is concerned. Could you please show the previous slide with the photograph, please? Thank you. Yes. So there are two main barriers which majority of the Indians face: physical activity insecurity and high heat, which is all pervasive and perennial. Next slide, please. Thank you. The good news is that the Central Board of Secondary Education, which is the main education board in India, has made physical education and health compulsory in all classes in India. We also find that Delhi is one of the rare cities where its master planners have left open spaces for parks. We are in the process of studying their availability, accessibility, and usability. Also, the Prime Minister of India, Shri Narendra Modi, has launched the Fit India movement in August 2015 to make physical fitness a way of life. Thank you for inviting me. Over to you, Olivia.
Thank you so much, Professor Glenken, for sharing your experience in India. It's really, really interesting. Thank you. And I want to move now to our last case study and introduce you our next panelist, Professor Greg White. He is the chair of the Scientific Advisory Board of UK Active. He's an Olympian in modern pentathlon and is a European and world medalist. He's a specialist in the field of sports, exercise, and health science, and currently a professor of applied sports and exercise science at the Liverpool John Moores University. He is an internationally recognized expert, and he published over 350 peer-reviewed papers and 8 books on the subject. So it's really my pleasure to welcome Professor White.
Thank you very much, Olivia. Thank you for having me. If we can have the first slide, please. So just to give you the background of UK Active, I'm a board member of UK Active, but I also chair the Research Advisory Board for UK Active. And effectively, UK Active is a not-for-profit health body which represents over 4,000 businesses across the physical activity sector in the UK. And it does it in a number of different ways. First is around representing and advocating on behalf of businesses across the physical activity sector. There's over 4,000 members and partners of UK Active. Secondly, we have an incredibly active division, which is the Research Institute, which is involved in demonstrating the safety of the sector and its impact on physical and mental well-being of physical activity. Then there is the Public Affairs and Policy Unit, which works very closely with government and government bodies, in particular the DCMS, Department of Culture, Media and Sport, Public Health England, Sport England, etc. And then there is the projects and campaigns. So it's taking those public affair and policy issues underpinned by research and actually making them into projects and campaigns across the UK. I've been asked today to talk about gender inequality when it comes to physical activity from a UK perspective. So let's take a look at that with the next slide, please. So when we take a look at physical activity levels, what we see is that the UK sadly has a very significant problem with inactivity. And when we talk about inactivity, we're talking about less than 30 minutes of activity per week. And we've heard Fiona talk very eloquently on the role of 150 to 300 minutes a week. Around about 11 million adults do less than 30 minutes of activity in a week. And around 6 million children are also deemed as inactive, doing less than 30 minutes. But actually, when you look inside that data, what you'll see is that there are significant disparities between genders. But of course, again, as we've heard from other speakers, is that there are significant differences between regions, socioeconomic status, ethnicity, and disability. So critically, if we are looking for solutions to inactivity, what we do have to do is make sure that we address these disparities across all of these socioeconomic, cultural, ethnic, diverse populations that we have in the UK and across the world. Next slide, please. Just to talk about COVID and the impact of COVID on gender inequality when it comes to physical activity. What was interesting pre-COVID was that there was a move of an increasing level of activity across the UK. It was an increase of over 400,000 regularly active adults prior to the COVID-19 pandemic. And at that time, there was a small reduction in the gender gap, where we saw 61% of women who were deemed as regularly active versus 65% of men. Sadly, following the first lockdown, we're currently in the midst of our third lockdown here in the UK, but following the first lockdown, what we saw was a dramatic reduction in activity of adults in general. There was a 7.1% reduction. That's around about 3 million adults became less active and were no longer classed as active. There was an increase in inactivity. And again, Fiona has spoken about this issue of being sedentary, but we saw 3.4 million more adults who were deemed as inactive. But interestingly, when we look at the gender gap, what we see is that we see a growth in this gender gap. 40% of women reporting doing less physical activity than usual during the first lockdown. And importantly, again, 39% of people with long-term conditions reporting doing less activity than usual. So it's how it impacts on various portions of the population when we talk about physical activity. Next slide, please. Now, if we take a look specifically at women and why we saw a reduction in that activity, and this is lovely work from Sport England on a survey from Sport England published just late towards the end of last year, but it showed that the number one reason for women to be less active was around the anxiety of catching or spreading COVID-19. But second to that was the access to facilities that we live in. We live in the UK. It rains an awful lot in the UK, and so of course weather makes a big appearance there. And of course the access to facilities effectively limits the ability or the what is on offer with regards to physical activity. So the range of activities that are on offer is reducing, and of course schools were closed in the UK, and what we saw was a dramatic increase in the caring responsibilities of women, particularly around homeschooling of children. And so what we saw is a disproportionate impact on women, which led to a growth in this gender gap, effectively reflecting way before the 2019 numbers that we saw earlier. Next slide, please. So on my final slide, again, drilling down further into this data, why do we see this disproportionate impact on women? Well, what we saw is the closure of gyms, so leisure and fitness facilities across the UK, across all three lockdowns. They were the first things to be closed, and in some instances, one of the last things to be reopened. And what we see is that over half of gym members in the UK are women. But importantly, it's actually around these group classes. Is that 3/4 of group classes attended by women, the three most popular being indoor cycling, aerobics, and yoga. And also, if we take a look at swimming pools, again, indoor facilities were closed. Women make up over half of those people visiting swimming. And so therefore, what we see is that when we close facilities, importantly, we have a disproportionate impact on women when it comes to physical activity because of the lack of access to group sessions and swimming. And we see this disproportionate impact. And so therefore, when it comes to policy, what we do need to do is streamline the policy in order to address the specific issues around gender in order to enhance physical activity within gender. And then finally, just let me touch on pregnancy, as we've spoken about pregnancy previously. What we saw is that during lockdown is that only 28% of pregnant women reached the WHO guidelines for physical activity for health. So effectively 2 in 3 women were not active enough during pregnancy, during lockdowns. And the primary reason for that was linked to safety. And 80% felt that the loss of the type of activity and specialist support provided by the leisure and fitness sector was the key reason for the reduction in physical activity during lockdowns. So I think what we've seen in the UK is that if we are going to create policies around increasing physical activity, in addition to gender, there are a host of other factors that we must take into account if we are going to be successful in increasing physical activity. Thank you very much.
Thank you so much, Professor White. That was really interesting. And I would like now to encourage all our panelists to please turn on their cameras. And we're gonna finalize our webinar with a section of question and answers to all of you. And we don't have a lot of time, but I really do want to make sure that we use that time since we have such a global, pool of panelists here. And I think we need to start with something that Professor White touched on. We can't ignore the fact that we're still in the middle of a pandemic, and that this pandemic has shown this tremendous paradox where, in a way, people with obesity are hit hardest and they have the most serious complications. At the same time, in many places at different times, people were not allowed to do any physical activity or to be outside their house. So on one hand, it's safe to be home, but it's actually not safe to be home and to be sedentary. And I think Professor White touched on the gender gap that this produced, and I'm sure we are also going to see a socioeconomic gap depending on where you're from. So I really want to ask you all, because unfortunately, I don't think this is the last pandemic that we're going to see on our lifetime. So what can we learn from COVID-19 and how it dealt with physical activity, and how can we answer better to this kind of crisis in the future? Now, it's a tough one because we're still in the middle of it, but I think that things happen for us to learn and do better in the future.
Perhaps if I can go. I mean, I think without any shadow of doubt, what we are in the midst of is a health crisis. And I think the one thing that we do have to reflect on is the fact that we need to positively improve health in order to fight the pandemic. I've written a series of blogs, and one of the blogs I wrote was actually around the vaccine. And actually the physical activity and the efficacy of the vaccine is a really important role as well. So as well as improving at one end of the spectrum, physical activity for the improvement of health, particularly immune health, would have a profound impact on the impact of COVID-19, but all the way through to the rollout of the vaccine and the importance of being physically active and having a healthy immune system in response to the vaccine. I think what we have reflected on over the past 12 months is actually that public health really does matter, and that what we should be doing is adopting as many positive policies as we can to enhance general public health, the whole of the public, if we are going to limit the impact of future pandemics.
Thank you so much. Professor Luzenska, I see that you have your hand up.
Yeah, thank you. I just wanted to raise a topic that, similar like in UK, we actually have seen an increase of over 40% of people who reduce their physical activity during the pandemic, but we also have seen over 50% of people who increase their sedentary behavior, and a very, very small proportion, less than by 5%, actually reduce their sedentary behavior, whereas about 19% increase their physical activity. So there is a small group that has increased physical activity, but there is no such trend almost for the sedentary behavior. So this is certainly a good time to raise the issue of the policies which are targeting or addressing awareness of sedentary behavior role in keeping the right energy balance. So I think that this area should be also touched upon. Thank you.
Thank you so much. Dr. Bull first, and then Kate Aldridge turning.
Yeah, thank you. And thank you for the question. It's quite challenging. However, I'll be a little bit more specific than Greg. I think we've got plenty of policies, Greg. We actually need to implement them. So I would suggest that actually what we've learned is we've underinvested in the promotion of physical activity, and we've underinvested in the diversity of opportunities people need. We've underinvested in the walking and cycling facilities, the public open space facilities. And we need to value, as Greg has pointed out, and this is the time to value and reconsider. And when I've finished, I'll drop in the chat box that this is a call that the UN has made in December, calling for the system of sport, physical activity, recreation, fitness to be supported, but also challenged it to reinvent itself. It's a system that is fragmented. It serves some, but not all. And so it's a real wake-up call for the fitness sector, for the promotion of physical activity, and for local communities who are not investing in ways that everyone can be active, people of all ages, all abilities, and of course the gaps that have been pointed out by gender, etc. So I call on us to move on from talking about the problems to looking at the solutions and challenging the lack of investment in this area. And I'll pop a document in the chat box and invite you to join WHO's discussion, which we held on Tuesday, and can keep going. And I'll pop a link to that too, which is challenging the reinvention that will require all of us to work better together. Thank you.
Thank you so much. You touched on inclusivity, which is such a crucial point here. I think that COVID has really shed a light on how divisive and how unfair many systems are. So, but thank you. Kate, you also had your hand up.
Yeah, well, thank you, Professor Bull, for your comments, which I would entirely wholeheartedly agree with. I also would add that I think COVID has been a massive disruptor, and there are some green shoots that I think we could grasp onto, some policy initiatives that have perhaps had the light of day and oxygen that perhaps they wouldn't have had for a number of years, or they've been expedited in the UK because people were frightened to get on public transport. You've seen investment in walking and cycling. So there are things that I think we should as a community really grab onto and hold onto and say they're really precious and they should not go. In Paris, we have the 15-minute city idea, the kind of localization agenda. And so I think there are a lot of policy initiatives that, as Professor Bull has said, that we should absolutely hold on to. And it's this investment idea and the political will, and hopefully the kind of building back better agenda post-COVID can really help galvanize that. And I think it's up to us to really push that and say there are some really good ideas. We've just got to get on with them and do them. So that's what I would add.
Thank you so much. I know we only have a couple of minutes left, but as World Obesity Federation, and as we just launched our position statement, I need to ask you, because for us, I think the difficulty is that there has been so much focus and research and narrative so far around obesity and about being it about individual responsibility, and it's just about eating less and moving more. And we know that it isn't. We know that obesity is a complex chronic disease, and it's not about eating less and moving more. But we also know that moving more is essential for overall health. So how do we make sure that we can encourage people to be more physically active, but also understanding that it's not going to be the silver bullet that is going to help them with obesity? I know this is a difficult one. It took us a long time to get our position statement together.
Well, I'm always happy to talk. So, I mean, I think, just coming back to Fiona and Kate's point, I think they're absolutely right. I think the bottom line is that what we do is we place an awful lot of emphasis on the individual. And what we know is that behavior change is probably the most difficult thing to initiate in an individual. But to my mind, what we've got to do is actually we've got to change the behavior of states. Is that what we have? I mean, the UK, and I think this is the same globally, is that it is a reactive medical system that we have. Is that we wait for people to get sick, we wait for people to become obese, and then we think to ourselves, let's do something about it. And I think that what we've got to do is we've got to invest in prevention, and we've got to promote the importance of health to people. But that does, you're absolutely right, it does come down to investment, but that investment requires behavior change at governmental level. They've got to understand that reactive medical systems simply do not work appropriately. And we have to spend an awful lot more and invest an awful lot more in prevention.
Thank you. They're also not cost effective in the long term.
No.
Any other final remarks on this? So if we don't, I really wanted to thank all of our amazing panelists today. It was such a pleasure to share this webinar. Thank you for sharing your story and your case studies and your work with us. You also shared so many important and interesting resources, so everyone will have access to all of them. And make sure that whoever popped in a question at the question and answer, if you haven't had an answer yet, we're going to try to reach out to all the panelists and get you your answer. So make sure that you go also to the World Obesity Federation website. You can read our position statement. You can have our policy dossier. You can explore the database. I think Dr. Bull also put in a few resources. You have UK Active. So please keep engaged in this important topic. And thank you so much for being here with us today. Thank you. Goodbye, everyone. Thank you.
Thank you. Thank you very much. Goodbye.
Thank you.
Thanks, guys. It's been great.
Thank you. Stay active.
Thank you. I'll go now for a run. It's not raining, which is a first in the UK, so we're going to go for a run. Thanks.